Hello, my name is Emma Dye, and this is my Module 2 reflection video. I will start by saying that the prompt is right behind this camera, so if you see me looking off to the side, that is why. So our first question asks about what has been going well this week. I feel like the fundamentals module, which we completed this week, went pretty well. There's absolutely some room for improvement, but it also showed me a pathway forward as far as what's going to work best for me with studying. We have the option to do dynamic quizzing, and I think starting my week with those dynamic quizzes is going to help me have better outcomes for all of the future modules, just to kind of get ready for all those questions under that particular topic for the week. So this week we're talking about an instance where we use nursing judgment. So one of the instances that I think back to was on our clinical that I completed last summer. This particular patient was experiencing quite a bit of constipation. She hadn't had a bowel movement in over 3 days, I believe. And one of our assignments to go along with this clinical experience was to write about a nursing diagnosis one of our patients exhibited and to create a care plan regarding that diagnosis. So the nursing diagnosis clearly for this patient was constipation, and I wrote a care plan that involved movement, helping her get up and walk around and see if that helped some peristalsis. Talking to nutrition and see if anything in her diet could be changed to help her have a bowel movement. And then moving on up to medications such as Dulcolax or Miralax or polyethylene glycol, as well as the potential for an enema. And while those things would be prescribed by the provider, these were included in my nursing plan to make sure that I was prepared for next steps. So I felt pretty good about my plan. When I came back the next day, they had implemented this plan, not necessarily because of me, but because that's what their protocols were anyway, and that was a confidence booster, which was great to kind of know that I was on the right track as far as care went. I think the only thing they didn't include immediately, because it had already been 3 days, was a diet change that would help her have a bowel movement now is more of a diet change for the future. And these are the kinds of bits of information that I will need moving forward, and I think I'll be able to have wherever I end up working, they'll have their protocols and what makes sense for them to do, and that will help guide my nursing judgment as far as knowing if I should contact the dietitian for that particular patient. This will certainly make me a better nurse, because even in cases where it's managing one symptom that might be part of a bigger problem, I think that patient in particular was a cancer patient, so the constipation was as a result of opiate medications she took as pain management, so clearly this patient had a lot going on. But symptom management like this is going to call into question everything that we are doing to treat this patient, and have me use critical thinking to manage, because this is going to look different for every single patient. And that's definitely going to make me a better nurse, because we talk a lot about how we want to approach patient care with a holistic mind, because it's important to take care of the patient on all levels: mind, body, spiritually, physically, all of the things that we can accomplish for them as their nurse. That's what we want to try and do. And this plan really showed me how in-depth that can be, because we're plugging in one problem like constipation into her entire clinical picture of cancer. So this felt really great to have experience writing a plan for a patient that really needed help. Even though this was one particular symptom out of many, it was a great experience to be able to critically think about what that patient needed to manage this situation specifically. Thank you for watching.